Hello, this is Dr. Jawad. I've had a lot of patients over the years, good, hardworking people sit across from me and say something like, Doc, I just don't feel like myself anymore. I'm not sick exactly, but I'm tired, I'm slower, I don't bounce back like I used to. And every time I lean in and tell them the truth, it's not all in your head. And no, it's not just age. Yes, the body changes as we get older, but that doesn't mean energy, clarity, or performance have to disappear. Not at all. In fact, this stage of life can be a time of renewal if we give the body what it truly needs. I'm talking about real, cellular level support, not fads, not hype, just proven fundamental tools. Today, I want to walk you through something simple but powerful: three essential vitamins, the kind most people over 50 are missing, that can dramatically impact how you feel each and every day. We're going to talk about how these nutrients affect your energy, your sleep, your mood, even your brain and muscles, and I'll share with you what I share with my own patients, how to get tested, what to look out for, and what you can do starting today. Because you deserve to feel strong, focused, and alive, not just getting through the day, but living it fully. Let's get into it. One of the most common things I hear from people in their 50s and beyond is, Doc, I'm tired, I'm not myself, I'm slower than I used to be. And when we really sit down and start peeling back the layers, so often the culprit is something simple but powerful: nutrient depletion. Let's start with vitamin B12. Now, this little nutrient doesn't always get the attention it deserves, but let me tell you, it's an absolute game changer when it comes to energy. I like to call it the spark plug of the human body. Why? Because B12 is critical for making healthy red blood cells. Without it, your oxygen delivery system starts to sputter. That means you're not getting the fuel you need to your brain, your muscles, your heart. The result? Fatigue, brain fog, weakness, and sometimes even mood swings or numbness in your hands and feet. Now, here's the part most people don't know. As we get older, our ability to absorb B12 from food drops significantly. Your stomach needs strong acid to extract B12 from the protein in food, and once you're over 50, acid production tends to decline. Add medications like metformin or acid blockers to the mix, and you're even more likely to end up deficient. So, what do? First, we test. I always recommend people over 50 get their B12 levels checked, not just the bare minimum on the lab report, but what's optimal for energy and cognition. If you're on the lower end, there's an easy fix. Sublingual B12 under the tongue absorbs well. Some people need monthly B12 shots, and for many, just adding 1000 mg daily of methylcobalamin B12 can turn things around fast. You don't need to just survive the day, you deserve to thrive, and this is where B12 makes a difference. More energy, sharper thinking, even better sleep in some cases. Now let's talk vitamin D. I know you've probably heard of it, but what you may not know is that it's not just a vitamin, it actually functions more like a hormone, and it controls the expression of over 1000 genes in your body. Vitamin D impacts everything from your bones to your brain, your immune system to your hormones. Low levels are shockingly common, especially for those of us living in areas with less sun or who spend a lot of time indoors. I've had patients who were outside plenty but still tested deficient, especially in the winter. When vitamin D is low, we see more infections, more depression, slower recovery, achy joints, hormonal imbalances, even a greater risk of falls and fractures. So, what do I recommend? First, test your blood levels. You want to be in the sweet spot, not just not deficient, but truly optimized. I aim for 50 and 80 ng/ml for most of my patients. Then, depending on the result, we usually supplement with D3, ideally combined with K2 to help regulate calcium and support your arteries and bones. The typical range is 2000 to 5000 IU per day, but testing will guide you. Then we come to magnesium, the unsung hero of vitality. This one's especially close to my heart because I've seen it transform people's sleep, mood, and muscle recovery within weeks of correcting a deficiency. Signs of low magnesium include muscle cramps, irritability, insomnia, and low energy. If that sounds like you, it's time to take a closer look. Add magnesium-rich foods like leafy greens, almonds, avocados, and yes, a little dark chocolate, and consider supplementing. I typically recommend magnesium glycinate or magnesium citrate. 300 to 400 milligrams in the evening does wonders for most people. I've had patients go from restless, tired, and wired to sleeping peacefully and waking up energized just by restoring their magnesium levels. So what's the bottom line? You don't have to feel stuck. You don't have to accept fatigue, brain fog, or low motivation as your new normal. Not when there are simple science-backed tools like these three essential nutrients that can completely reshape how you feel. B12 for clean, lasting energy. Vitamin D for hormone strength, immunity, and resilience. Magnesium for recovery, calm, and clarity. You've got a choice. You can keep pushing through the tiredness, or you can take action and give your body what it's been asking for. Because the second half of life isn't about slowing down. It's about showing up stronger, wiser, and more alive than ever before. Let's make that happen starting today. If you're over the age of 50 and you've noticed a persistent lack of energy, brain fog, or even a tingling sensation in your hands or feet, it may not just be aging, it could be a sign of vitamin B12 deficiency. This is something I see quite often in clinical practice. People come in assuming they're just getting older, but the truth is B12 plays such a critical role in how your body and brain function that even a slight deficiency can make a noticeable difference in your daily performance. Vitamin B12 or cobalamin is essential for DNA synthesis, red blood cell production, and proper neurological function. Without enough of it, your body simply cannot produce healthy red blood cells efficiently. And when your red blood cell count is low or the cells are not functioning optimally, your tissues and organs don't get the oxygen they need, and the result? Fatigue, weakness, lightheadedness. That slow, sluggish feeling that so many attribute to aging can, in reality, be a B12 problem. The challenge becomes even more significant after 50. That's because as we age, our stomachs begin to produce less hydrochloric acid, a substance necessary to release B12 from food sources like meat, fish, eggs, and dairy. In younger individuals, the acid breaks down food in the stomach and allows B12 to bind with a protein called intrinsic factor, which is then absorbed in the small intestine. But in many people over 50, this process becomes inefficient, leading to a gradual and often unnoticed deficiency. It's not uncommon for this deficiency to go undiagnosed for years. Many patients are treated for symptoms like depression, poor memory, or neuropathy without anyone checking their B12 status. That's a huge oversight, because vitamin B12 deficiency doesn't just affect energy, it also impairs cognition and neurological health. It's linked to memory loss, irritability, confusion, and in severe cases, even irreversible nerve damage. Certain groups are at even greater risk. If you're taking medications like metformin for type 2 diabetes or proton pump inhibitors for acid reflux, both very common in individuals over 50, your risk of deficiency increases dramatically. These medications interfere with B12 absorption. Vegetarians and vegans are also particularly vulnerable, as B12 is naturally found only in animal products. In these cases, dietary intake isn't enough, supplementation becomes essential. But here's the key, not all B12 supplements are created equal. Oral supplements in the form of cyanocobalamin are common, but many people, especially those with absorption issues, do better with sublingual methylcobalamin. This form dissolves under the tongue and bypasses the digestive system entirely, allowing for more efficient uptake into the bloodstream. The bottom line is that if you're over 50, you should not be ignoring vitamin B12. It's not just another vitamin on the list, it's a non-negotiable component of how your brain and body generate energy, protect nerves, and function at their best. Ask your healthcare provider to test your B12 levels, and don't settle for normal if you're symptomatic. Optimal B12 levels should be above the lower cutoff, ideally in the upper half of the reference range. You have more control over your vitality than you think. And sometimes all it takes is correcting one overlooked nutrient to feel like yourself again, sharp, strong, and energized. Vitamin D is far more than just the sunshine vitamin. It functions in the body more like a hormone, influencing everything from your bones and muscles to your mood, immune system, and even cardiovascular health. And yet, after the age of 50, it becomes one of the most commonly overlooked and underdiagnosed deficiencies, especially in individuals who spend less time outdoors, have darker skin tones, or live in regions with limited sunlight exposure. Let me be very clear, a deficiency in vitamin D is not subtle in its consequences. It doesn't simply result in weak bones or a higher risk of fractures, it impacts multiple systems simultaneously. Many of the complaints I hear in older adults, fatigue, chronic pain, depression, increased infections, and slow recovery from illness, can often be traced back to low vitamin D levels. One of the most important roles of vitamin D is in calcium metabolism and bone remodeling. Without adequate vitamin D, the body cannot effectively absorb calcium from the gut, and when calcium is deficient, your body will begin pulling it from your bones to maintain stable blood levels. This leads to the weakening of bones over time, increasing the risk of osteopenia and osteoporosis, particularly in postmenopausal women and older men. But this is only part of the picture. Vitamin D is also intricately involved in the regulation of the immune system. It activates the immune cells that help your body detect and destroy pathogens. In fact, individuals with low vitamin D levels tend to experience more frequent colds, respiratory infections, and longer recovery periods. This was demonstrated repeatedly in clinical studies, including large meta-analyses, showing that regular vitamin D supplementation significantly reduces the risk of acute respiratory infections, especially in those who are deficient. From a hormonal standpoint, vitamin D interacts with nearly every tissue in the body. It influences testosterone production in men and supports estrogen balance in women. Low vitamin D levels are associated with reduced muscle mass, impaired glucose metabolism, and higher body fat percentages. For anyone over 50 who is trying to maintain their strength, prevent frailty, or manage their weight, this nutrient is essential. The brain has numerous vitamin D receptors, and adequate levels are crucial for neurotransmitter function, including serotonin synthesis.
This helps explain why so many people report feeling more energetic, mentally clear, and emotionally balanced after restoring their vitamin D levels. The problem, however, lies in awareness and proper testing. Most people have no idea they're deficient because symptoms are often non-specific: low energy, poor sleep, muscle aches. That's why I always recommend a simple blood test, the 25-hydroxy vitamin D test, or 25-OHD. While the normal reference range often goes as low as 30 nengravil, I encourage my patients to aim for an optimal range between 50 and 80 nengravil for best results in terms of performance, immunity, and vitality. When it comes to supplementation, not all forms are equal. You want to look for vitamin D3 cholecalciferol, not D2 ergocalciferol, as it's more bioavailable and better utilized by the body. Additionally, pairing vitamin D3 with vitamin K2 is crucial. Why? Because while vitamin D enhances calcium absorption, vitamin K2 ensures that the calcium is directed to the bones and teeth, not deposited in arteries or soft tissues, which can be harmful. The standard starting dose for most adults over 50 is in the range of 2,000 to 5,000 IU daily, depending on body weight, sun exposure, and current deficiency status. However, it's always best to dose based on blood levels and to recheck levels every 3 to 6 months when supplementing aggressively. In summary, vitamin D is not just a bone health vitamin, it is a master regulator of health and resilience, particularly as we age. Optimizing your vitamin D levels is one of the simplest, most cost-effective strategies for preserving your energy, preventing illness, and staying active and vibrant well into your later years. Magnesium is one of the most underestimated nutrients when it comes to maintaining health, especially after the age of 50. Despite its critical role in over 300 enzymatic reactions within the body, magnesium deficiency often goes undiagnosed, not because it's rare, but because it's not routinely tested, and the symptoms are so widespread that they're frequently attributed to aging or other conditions. In my experience, magnesium is what I often refer to as a master mineral because when it's optimized, nearly every system in the body works better, including energy metabolism, muscle recovery, heart rhythm regulation, and sleep quality. Let's start with energy. Magnesium is required for the production of adenosine triphosphate, or ATP, the primary unit of energy your cells use to function. In simple terms, without enough magnesium, your body can't efficiently convert food into usable energy. Many patients over 50 complain about feeling drained, even after a full night's sleep. They assume it's just part of getting older, but often it's a sign that their cells are struggling to make energy due to inadequate magnesium stores. And this isn't just a theory, it's something I've witnessed improve consistently with proper magnesium replenishment. Beyond energy, magnesium plays a vital role in the neuromuscular system. It regulates muscle contractions and nerve transmission. A deficiency can manifest as muscle cramps, twitching, spasms, or even heart palpitations. This is particularly relevant for older adults who may already be dealing with muscle stiffness or cardiac issues. Low magnesium levels can contribute to arrhythmias, irregular heartbeats, which are increasingly common with age. In fact, in patients with atrial fibrillation or other cardiac conduction abnormalities, magnesium is often a key part of supportive therapy. Sleep is another area where magnesium exerts profound influence. It helps regulate neurotransmitters like GABA, gamma-aminobutyric acid, which promotes relaxation and deep restorative sleep. When magnesium levels are low, sleep quality often declines. Patients report difficulty falling asleep, staying asleep, or waking up feeling unrested. What's remarkable is how often this improves within just a few weeks of magnesium supplementation. I've had countless patients, particularly those struggling with insomnia or nighttime anxiety, report that they're sleeping through the night for the first time in years. There are several reasons why magnesium deficiency becomes more common with age. First, absorption decreases as we grow older. The efficiency of the digestive tract diminishes, and this affects mineral uptake. Second, the kidneys excrete more magnesium with age. Third, modern lifestyles compound the issue. High stress levels, poor dietary choices, caffeine, alcohol, and common medications like diuretics, antacids, and proton pump inhibitors all deplete magnesium further. And let's not forget about diet. Even if you eat a balanced diet, today's soil is far less mineral rich than it was decades ago. Magnesium content in vegetables has declined significantly over the past century due to industrial farming and soil depletion. So even individuals who eat what we consider a healthy diet may still fall short of their magnesium needs. In terms of supplementation, not all forms are equally effective or well tolerated. Magnesium oxide, for example, is cheap but poorly absorbed and often causes gastrointestinal discomfort. For therapeutic use, I recommend more bioavailable forms, such as magnesium glycinate, which is calming and gentle on the stomach, or magnesium citrate, which can be helpful if mild constipation is also an issue. The ideal dosage for most adults over 50 ranges from 300 to 400 milligrams per day, taken in the evening to support relaxation and sleep. Finally, while blood magnesium tests are available, they are not always reliable. Only about 1% of the body's magnesium is in the bloodstream, the rest is in bones and soft tissue. Therefore, symptoms rather than test results alone are often the best indicators of deficiency. In summary, magnesium is a critical component of aging well. From energy production and muscle function to heart health and restful sleep, it supports nearly every aspect of vitality. Replenishing this vital mineral can help restore balance, enhance daily performance, and improve overall well-being in a deeply noticeable way. One of the most important messages I share with patients over 50 is this: don't guess test. When it comes to your health, especially your micronutrient status, assumptions can be dangerous. Many individuals walk around feeling chronically fatigued, mentally foggy, or emotionally flat, and they chalk it up to getting older. But in many cases, these symptoms are driven by subtle, yet very correctable deficiencies in vitamins and minerals like B12, vitamin D, and magnesium. The only way to know what your body actually needs is through proper testing. Let's take vitamin B12 as an example. A standard serum B12 test might come back normal, but what many people don't realize is that the reference range is very wide. You could be at the low end of that range, say 200 or 300 picos in low, and still experience all the classic signs of deficiency: fatigue, numbness, poor memory, and mood changes. In my clinical practice, I don't just look for numbers within range, I look for optimal levels. For B12, that's usually about 500, often closer to 800 picos in a low, for older adults who want to feel vibrant and mentally sharp. Vitamin D is another nutrient that absolutely must be tested, and yet it's one of the most commonly ignored labs in standard checkups. Most people don't know they're deficient until they get a 25-proxy vitamin D test and discover that their levels are well below optimal. The lab might say anything above 30 into a low is acceptable, but I can tell you from experience that people feel and function best in the 50 to 800 range. Levels below 30 can lead to a weakened immune response, poor bone density, mood disorders, and low energy, and this is entirely preventable with a simple test and targeted supplementation. Now let's consider magnesium, which presents a unique challenge. The majority of magnesium is stored in bone and soft tissue, so standard serum magnesium tests often fail to reveal a true deficiency. Someone could be symptomatic, experiencing muscle cramps, heart palpitations, or sleep disturbances, and still have a normal serum magnesium level. That's why I prefer the magnesium RBC test, which offers a more accurate reflection of cellular magnesium status. Even then, interpretation matters. Optimal levels are typically above 6.0 milligram deal, not just in the range. Routine testing becomes even more critical when you consider the medications many people over 50 are prescribed. Drugs like metformin, statins, diuretics, and acid blockers can all deplete key nutrients over time. If you're not aware of what those medications are doing to your nutrient balance, you may start to experience side effects or new symptoms that are actually signs of depletion of disease progression. For example, long-term use of proton pump inhibitors, PPIs, can interfere with the absorption of B12 and magnesium, both of which are crucial for nerve function and energy production. If we don't test, we miss the opportunity to intervene early. Furthermore, proper testing allows us to customize your care. Health is not one size fits all. Two people of the same age can have drastically different. The idea that if it's not broken, don't fix it. You'll start applying your health and thinking doing it. Quietly for years. Testing empowers you to make proactive. While the methods and testing yourself in a destroy it, one of the genetic definitions before it becomes a serious problem. Because what you don't know can hurt you, but what you do know can help you decide you don't different types of connected market is one that you have interview. When it comes to nutrition and the age of 50, the foundation of optimal health must begin with food. Supplements absolutely is the basic, and we'll get to that, but it's important to remember that the body is biologically wired to recognize and utilize nutrients that come from food, unprocessed food. Nature has many vitamins and essential minerals in complex and existing forms, combined with fiber, nutrients, and fatty acids and enrich for its natural function and functionality. So absolute value is probably processing many predictors like, let's take magnesium for example. In the farming of leafy green vegetables like spinach and nuts such as almonds and cashews, it things like pumpkin and chia, and even in dark chocolate. These foods don't just give you magnesium, they also provide fiber, helping balance and additional minerals like potassium and zinc, all of which work together to support cardiovascular and metabolic health. Similarly, systemic fish like salmon and mackerel are rich in vitamin B, but they also deliver omega-3 fatty acids which reduce inflammation and support brain health. The skeleton seems to be not be manufactured in the lab.
That said, while food should always be the primary source of nourishment, it's equally important to acknowledge that our modern food supply isn't what it used to be. Industrial farming practices have stripped the soil of many essential minerals, which means the vegetables we eat today often contain significantly less magnesium, zinc, and selenium than they did 50 years ago. Add to that the fact that many people over 50 have reduced appetite, slower digestion, or dietary restrictions, and the risk of nutrient gaps becomes very real. This is where supplements come in, not as a replacement for food, but as a targeted strategy to fill in the missing pieces. Think of it like this: food is your foundation, supplements are your insurance policy. They ensure that even on days when your diet isn't perfect, and let's be honest, we all have those days, your body still receives the nutrients it needs to function at its best. However, not all supplements are created equal. Over the counter multivitamins may offer convenience, but many contain low quality, poorly absorbed forms of nutrients. For instance, magnesium oxide is commonly used in cheaper supplements, but it has very poor bioavailability and can cause gastrointestinal distress. A better option is magnesium glycinate, which is well tolerated and easily absorbed. Similarly, many multivitamins contain synthetic forms of B12 cyanocobalamin, whereas methylcobalamin is the active bioavailable form your body actually uses. Another point to consider is dosage. The one-size-fits-all approach does not work when it comes to supplementation. Your needs are unique and should be based on lab testing, symptoms, lifestyle, and medical history. For example, someone with low sun exposure and darker skin may need a much higher dose of vitamin D3 to achieve optimal levels compared to someone who spends more time outdoors. A person on metformin may require extra B12, while someone dealing with chronic stress may need additional magnesium to help regulate cortisol and improve sleep. Timing and absorption also matter. Fat soluble vitamins like D and K should be taken with meals that contain healthy fats to enhance uptake. Magnesium is best taken in the evening to promote relaxation and sleep. B12, especially in sublingual form, is best taken in the morning to support daily energy production. Small adjustments like these can make a significant difference in how effectively your body utilizes these nutrients. So, the take home message is this: prioritize nutrient rich, whole foods every day, colorful vegetables, clean proteins, healthy fats, nuts, seeds, and fermented foods. Build your plate with intention, but don't hesitate to supplement wisely and intentionally when the gaps are real and the needs are clear. Especially after 50, when the body's efficiency in absorbing and utilizing nutrients begins to decline, that combination of food first and supplement smart becomes your most powerful tool for maintaining energy, clarity, strength, and resilience. There's a deeply ingrained belief in our culture that aging inevitably means slowing down, losing strength, and feeling tired more often. But from a clinical standpoint, I can tell you fatigue is not a natural consequence of getting older. It is a signal, a message from your body that something is out of alignment, and more often than not, it's a fixable issue. The idea that feeling run down is just part of life after 50 is not only false, it's dangerous. Because when we accept fatigue as normal, we stop looking for causes and, more importantly, we stop looking for solutions. I see it constantly in my practice. A patient in their late 50s comes in complaining of low energy, poor sleep, difficulty concentrating, or just a general sense of feeling off. They've been told it's just aging. But when we dig deeper, when we test for deficiencies, review their diet, check for chronic inflammation or hormonal imbalances, we usually uncover very real, treatable factors contributing to their decline in energy. And when those factors are addressed, it's remarkable how quickly that person begins to feel like themselves again, often better than they have in years. One of the most common culprits is suboptimal micronutrient status. Deficiencies in vitamin B12, vitamin D, and magnesium, three nutrients that are absolutely essential for energy production, nervous system function, and muscle performance, can masquerade as fatigue, depression, anxiety, and even early cognitive decline. These deficiencies are common in people over 50 due to changes in digestion, reduced dietary intake, and interactions with common medications. And yet, many individuals are never tested, let alone treated. Another overlooked factor is mitochondrial function. Mitochondria are the energy-producing factories inside your cells, and they are heavily dependent on nutrients like CoQ10, magnesium, B vitamins, and amino acids to function properly. As we age, mitochondrial efficiency declines, but not because of age alone. It's because of cumulative oxidative stress, poor diet, lack of movement, and chronic low-level inflammation. Now, I'm not suggesting that aging doesn't come with its own set of challenges. Of course it does. But I am saying that you have more control than you think. Aging well isn't about luck, it's about strategy. It's about making informed choices, being proactive, and refusing to settle for good enough when it comes to your health. Your energy levels, your mental clarity, your physical strength, these are not luxuries. They are indicators of how well your body is being supported. The most successful, vibrant people I work with in their later years all have one thing in common: they take their health seriously. They ask questions, they track their progress. They don't ignore signs of imbalance. And most importantly, they don't buy into the myth that feeling worse with age is inevitable. So let me be direct. If you're over 50 and you're feeling constantly tired, foggy, or sluggish, do not accept it as your new normal. Investigate, test, nourish your body intentionally, correct deficiencies, rebuild your strength from the inside out. You have the ability to age with vitality, with performance, and with a clear mind. You don't need to slow down, you need to level up your approach. Because fatigue may be common after 50, but it is not normal, and it's absolutely not your destiny.